Greetings from Balakrishna Eye Hospital. I am Dr. Rekha. Going to brief you about cataract. Cataract is nothing but opacification of the lens. So we have inside the eye something called a lens, which has to be transparent. Only then light rays will enter the eye, go through the lens, strike the retina, and from there the images go to the brain and we are seeing. So anything wrong in this pathway, there will be dimness of vision. So when this lens is becoming opaque due to various causes, there will be dimness of vision, and dimness of vision can develop gradually, and then it can lead to blindness also. And once if left untreated, it can cause lens induced glaucoma, because this can cause, at one stage the lens can bulge and cause lens induced glaucoma, or it can burst also and cause lens induced glaucoma. So now we have to diagnose. Once cataract is diagnosed, it's better to get treated early, because there are different types of cataract. Some cataracts are soft and some are hard. So the harder the cataract, difficult the surgery to do it through laser or phaco emulsification, because we cannot, we have to use more energy for the harder cataracts. So with soft cataracts, phaco emulsification is easier. So it was the old dictum that only when the cataract is very ripe, we have to get it operated. It's not like that these days. Once the cataract is formed and there is reasonably vision loss is there, then your doctor will advise you why it has to be done early, depending upon the type of cataract. So nuclear cataracts, you may be having vision, but the lens will become very hard and we cannot do phaco emulsification in those cases. So some of the cataracts we can prevent, some cataracts, not prevent, I won't call it prevention. So in some cases like congenital cataract, proper antenatal care can prevent some congenital cataracts. Then early treatment of diabetes also can delay the onset of cataract, using UV protection glasses, because these are all causes for cataract. The most common cause is senile cataract. However, cataract, there is no other treatment other than surgery, and surgery, different types of surgeries are there, right from open method surgery in which sutures are used. That was the earlier type of surgery. Now latest is the robotic phacoemulsification, which through a small opening we go lyse the cataract and suck it and remove it through the small opening, so there is no suture. Wound healing is faster, recovery is faster, and vision gain is faster. The patients can get back to normal life as early as possible. Thank you.
How can we test the vision after cataract surgery? Tell patient to close one eye. Show fingers at a distance of 1 meter. Ask the patient to count fingers. How can we put the drops safely? Tell the patient to raise heads, retract upper eyelids. Instill one drop, keeping bottle at a distance of 2 inches. Then give protective goggles. Can the patient see book and TV? Yes, patient can use his old glass and read and see TV. How can we clean the eye and eye shield, and how can we protect the eye while sleeping? Clean your hands and patient's hands with a surgical spirit and cotton. With the same cotton and spirit, clean around the eye also. Clean both sides of eye shield. Keep the eye shield on eye and use 2 micropore surgical tape to fix the shield to the eye. Remove it on next morning and start using goggles during daytime.
Good morning, I am Dr. Netra Balakrishnan. So today I am going to talk about eye care after robotic laser phaco emulsification. So how to prevent any infections. Let's go into the topic now. So first is you have to keep your hands away from your face and as well as your head, and you should not mop your eye or you should not use any towel or handkerchief for cleaning your eyes. Then the second point is after surgery, usually you have two types of surgery, that is one is for hard cataract and the other is for the soft cataract. For hard cataract you can only resume your work after 21 days and you can take head bath only after 21 days, and going out also is only after 21 days. If it is a mild cataract or if it is a soft cataract, you can actually get it, you can take your hair bath within 5 days and you can resume your work within 5 days itself, no problem. The next I am going to talk about is everyone will be asking what to eat after cataract surgery. Should we avoid non-veg or something like that? It is not like that. You can have anything, whatever is your normal diet, the regular diet you can actually follow. Okay, non-veg can be taken, and if you take some people will be taking any medications for their BP, heart problem or anything like that, you have to resume the medications. You should never stop those medications. You should continue taking those medications. And the next is relatives should be actually instructed how to use the medications properly. So like you have to train them. So first of all, the relatives should actually clean their hand wash, okay, so hands with regular hand wash, and then after that you have to ask the patient, we have to ask the patient to raise their chin, and with one lid, okay, we have to open one of our eyelids, and then with the nozzle should not actually touch the eyes or the surrounding area. Okay, that is because if the nozzle goes and touches the surrounding areas, there is a high chances of infection to spread. So you should avoid all those things, and then one drop is sufficient, and then you have to take some cotton, you have to soak it in the spirit and you have to squeeze it, and you have to clean the eye shield both sides, okay, in front and as well as back, and then you should with the help of surgical tape you have to put the shield, and then you have to close the eye completely. So why are we giving this is because it is just like a protection. So in night we won't know, okay, whether we are going to touch the hands or not. So just for a protection you can do this during the nights. Then patient can watch TV and they can read newspapers. There is no restriction that you should not watch TV or newspapers, but it is into a consensus that it should be for less time. And the next is you have to walk at least for 40 minutes inside your home itself if you are not able to walk outside. And vision is actually can be tested by the relatives itself. So while cleaning the eye, what happens is you have to ask the patient to count the fingers at 1 meter distance, okay, whether you are able to see the fingers correctly. So whether you are able to see 1 finger, 2 finger, 3 finger, 4 fingers, okay. So if there is any dimness of vision, you should come to the hospital immediately, and if there is any sudden pain, you should come to the hospital immediately. Thank you.
Robotic femto laser assisted phaco emulsification cataract surgery with the foldable intraocular lens. This is a no injection, no pain, no blades, no patch, no admission, no suture surgery. Patient is lied down on OT table. Microscope is adjusted. Femto laser is activated and tuned. Patient is anesthetized with topical eye drops. Eye is sterilized with cloths. Speculum applied to prevent the eyelid closure. Eye is steadied with a special vacuum. Femto laser applied based on power. Everything monitored through microscope and screen. Corneal incision, capsulorhexis and lens division done with femto laser. Lens is divided to 6 pieces. Anterior lens capsule is only 11 micrometer thickness and posterior capsule is 3 micron. Human hair thickness is 50 micron. Normal paper thickness is 70 micron. So the lens capsule is 10 times thinner of a hair. So femto laser is highly precise and error free than manual one. Femto laser head is then removed. The remaining procedure is same as routine phaco emulsification. Visco is injected to cover the cornea to make it wet. Anterior chamber ended through 1 to 2.8 millimeter incision on clear corneal on temporal side. Cohesive and viscoelastic injected to anterior chamber. Lens capsule is removed. Limbs forceps ended through second opening for side ports. Hydrodissection and hydrodelineation at various sites to separate capsule, cortex and nucleus. Each segment is lollipopped and emulsified. Accidental rent to anterior capsule should be prevented. Margin of safety is very less in this step. Remaining cortex is removed with irrigation and aspiration mode. Capsule polishing done. There are challenges in intumescent and hard cataract and fiber capsule and in smart people. For smart people, iris retractors are to be used. Capsular rim should be prevented from cutting. Endocapsular ring to be applied in case of joint dehiscence. Capsular bag is filled with visco. Foldable lens is injected into capsular bag. The remaining cortex is removed with the irrigation aspiration mode. Now you can see most of the cortex is removed. You can see the red glow that indicates. You can see the capsular axis ring. Further cleaning of the residual cortical matter and polishing is being done. After that, lens is injected into the bag. Lens will be unfolded automatically. Then lens is rotated and placed in correct position. Visco is removed from the front and back of the lens. Anterior chamber is formed with BSS and air. Stromal hydration done on 2 entries to make it closed. Now pre-filled lens injectors are available for hassle-free surgery. Acrylic, silicone, Collamer and HEMA lenses are available. Monofocal, trifocal, bifocal, intermediate, EDOF, accommodative, aspheric, yellow lenses are available. Chromatic, spherical aberration and glare should be prevented. Now see the conventional phaco emulsification cataract surgery with the foldable lens. Here femto laser is not at all used. All other procedure are same as in earlier procedure, and the preparation also same as in the earlier procedure. Patient is anesthetized with the topical drops. Eye is sterilized with bactericidal antiseptic drops. Lid speculum applied to open the eye. 15-degree blade used to make a side port entry to anterior chamber. Methylene blue injected to stain the anterior capsule. Excess stain removed with cohesive and viscoelastic material. Clear corneal phaco tunnel incision made with 2.8 mm angled keratome. Capsular excision is done with a cytotome and utrata forceps. The capsular excision should be prevented to go to the side. This is one of the very important steps in phaco emulsification surgery. This type of capsular rim will be very rigid. It will prevent tear. We can increase the size of the capsular excision further depending on the situation. Now we can do hydrodissection and hydrodelineation to separate the rim, capsular rim, cortex and nucleus. Cornea is cleaned with a viscoelastic material. Anterior chamber is filled with coccus and viscous material. This present cataract in this video is very soft and friable. The soft nucleus and the cortex is removed with a phaco. Epinucleus is removed. As I told you earlier, with capsule very thin, injury to the capsule should be prevented. Any capsular rent happens, vitreous loss will happen, then that will cause a lot of problem. Again the anterior capsular polishing is done. Visco is injected into the back. $13mm size foldable lens is injected to the back. It will occupy the capsular bag as the original lens was situated. If we put the lens in the capsular bag, that will give a lot of stabilization. Lens is unfolded automatically. Lens is rotated and kept in position with a hook and forceps. Pilocarpine and antibiotic injected. Anterior chamber cleaned with irregular irrigation and aspiration mode. Stromal hydration done to close the two wounds. Eye pressure checked. Bandage with antibiotic oil may be given for 1 hour. After 1 hour of surgery, eye will be checked and sent home with protective glasses. Patient will be reviewed after 3 days. Head bath is started 5th day onwards. Body bath is allowed from 1st day onwards. Now the hydration to close the two wounds are done. Otherwise there will be leakage of the fluid from the anterior chamber. The other opening, small side port entry is hydrated. Now the pressure is checked.